this patient was referred to us for examination and possible endodontic treatment of tooth number 2. So patient had some symptoms and was referred to another endodontist for endodontic treatment, and the other endodontist had recommended extraction, and patient didn't want to do it. So patient had gone back to her dentist, and her dentist referred her to us for a second opinion to see if this tooth could be saved, if there's any chance, or tooth indeed would have to be extracted. So I examined the tooth, and as you can see, there is some decay here. That's an inflammatory resorption that is subgingival, and as you can see, it's approximating the pulp of the tooth. So I went over options with the patient. We can try to see if we can save the tooth, but this is inflammatory resorption, so prognosis would be very guarded. We could try to see if we can save the tooth for you, go in and clean it out, repair it, and do the root canal for you. But you know, we couldn't tell you how many more months or years you would have this tooth in your mouth. Or the other option would be to just go ahead and extract it, take it out. And patient's young, and she said she didn't want to extract the tooth. She just wanted to keep the tooth in her mouth for as long as possible. So I said, okay, if that's, you know, that's what you want, we can do our best, and that's what we did today. So take a look here. So we went ahead, first off, we went ahead and cleaned out the decay, cleaned out this inflammatory resorptive defect. The dentin was affected, of course. Went ahead and cleaned it all out. It was all subgingival, so did a little gingivoplasty back there too. And then repaired it with MTA, and went ahead and did the root canal for her. Two mesial canals and 1 palatal canal. There was no distal canal here, no distal canal. And I was kind of surprised that I wasn't finding a distal canal, but take a look here. So here it is. We took this PA right after I had obturated the canals, just to make sure. And as you can see, there is no distal buccal canal here. So he had MB1, MB2, and a palatal canal. No distal buccal canal. All right, no distal buccal root. So anyways, we went ahead and completed, and here it is. All right, so as you can see, everything went well. Of course, the resorption, hopefully it'll stop, but you know, as I told the patient, sometimes we clean it out, we clean out the affected area, but the body might revascularize and continue to try to reject this tooth, resorb this tooth, try to reject it. So only time will tell. We don't know. Anyways, here it is. So we went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. Hopefully she'll have this tooth in her mouth for many years, but again, who knows? We don't know.